Say goodbye to monotonous books and say hello to colorful, interconnected mind maps. In this series, we will quickly help you revise important concepts with the help of mind maps, which you can access later using our app. In this video, we will quickly revise the topic of fungal infections of the oral cavity with the help of a mind map. Starting off, let's talk about Candidiasis. Candidiasis, also known as monoliasis, thrush, or lily of the valley, is the most common fungal infection and is caused mainly by Candida albicans. It is an opportunistic infection that is commonly seen in individuals with compromised immune systems. The causative agent, Candida albicans, exists in three forms: pseudohyphae, yeast, and chlamydospore. There are two main clinical classifications of candidiasis based on its location and presentation. The first one is primary candidiasis, which is confined to oral and perioral tissues. It can present as acute pseudomembranous thrush, which is characterized by curdy white flecks on the oral and perioral tissues. This form is most commonly seen in immunocompromised patients. Acute atrophic candidiasis, also known as antibiotic sore mouth, is the only type of candidiasis that is constantly painful. Chronic hyperplastic candidiasis, which can be leukoplakic type, is considered a pre-malignant condition as it is associated with oral epidermoid carcinoma. Chronic candida-associated lesion, which consists of denture candidiasis, angular cheilitis, and median rhomboid glossitis. The second type is secondary candidiasis, which comprises the oral manifestations of systemic mucocutaneous candidiasis and is seen as a result of underlying diseases like thymic aplasia and endocrinopathy syndrome. Histologically, candidiasis is identified through special staining techniques like periodic acid Schiff stain or methylene blue staining. In acute candidiasis, fungal pseudohyphae can be observed penetrating the upper layers of the epithelium at acute angles. There is typically neutrophilic infiltration of the epithelium with superficial microabscess formation. Treatment of candidiasis involves dealing with predisposing factors and use of topical and/or systemic antifungals. Suspension of nystatin, clotrimazole, amphotericin B, miconazole. The next important fungal infection is mucomycosis, also known as phycomycosis or zygomycosis. It is an opportunistic fungal infection that primarily affects debilitated individuals, particularly those with uncontrolled diabetes, ketoacidosis, and in COVID patients. It is caused by saprophytic fungi, including species of Rhizopus, Mucor, and Absidia. The infection usually enters through the nasal mucosa and can extend to the paranasal sinuses, pharynx, palate, orbit, and brain. Its early signs include reddish-black nasal turbinate and septum with nasal discharge, which leads to necrosis. Mucomycosis has a predilection for blood vessels penetrating their walls and causing thrombosis. It can present as a classical syndrome with uncontrolled diabetes, cellulitis, ophthalmoplegia, and meningoencephalitis. Its diagnosis is confirmed by Grogot's silver methamine stain, which shows non-septate hyphae branching at right angles. Round or ovoid sporangia may also be seen. The main approach to managing mucomycosis is controlling predisposing factors. Surgical excision may be necessary to remove infected tissues in severe cases. Antifungal therapy with amphotericin B is the primary treatment for systemic infections. Another important fungal infection is histoplasmosis. It is a systemic fungal infection caused by the fungus Histoplasma capsulatum. Histoplasmosis can have various clinical manifestations such as chronic low-grade fever and productive cough. Splenomegaly, hepatomegaly, and lymphadenopathy may be present due to systemic involvement. Oral manifestations include nodular, ulcerative, or vegetative lesions on buccal mucosa, gingiva, tongue, or lips. The ulcerated area may be covered by a non-specific grayish membrane. Histopathological examination of the lesion shows granulomatous inflammation characterized by a large number of phagocytic cells which appear as tiny intracellular structures. The next disease is aspergillosis, a fungal infection caused by the fungus Aspergillus fumigatus. It is most severe in immunocompromised individuals. Its spores may cause hypersensitivity reaction, which results in allergic bronchopulmonary aspergillosis. It causes bronchopulmonary aspergillosis, and symptoms include fever, breathlessness, productive cough, and worsening of asthmatic symptoms. In paranasal aspergillosis, the hard palate may be involved, while pulmonary aspergillosis may show soft palate involvement. Oral regions may present as painful ulcers with progressive necrosis. Histopathological examination of the lesion may reveal septate hyphae with dichotomously branched patterns. Treatment of aspergillosis involves antifungal medications, with amphotericin B being one of the primary options. In some cases, surgical debridement may be necessary to remove infected tissues. A few other notable infections of the oral cavity include blastomycosis and cryptococcus, which you can read about in our mind map. Some other diseases and their names can be noted from this section. With this, we come to the end of this discussion. Hopefully, we have helped you revise this topic quickly. You can head over to the MCQ section on our app and try solving a few questions. Happy learning!